Cervical cancer is one of the leading causes of death amongst women in the world. If 10 women are screened, about 6 of these women are found to have abnormal cells in the cervix. Cervical cancer is a cancer of the cervix, and it occurs when the cells of the cervix begins to grow abnormally and multiply. The cervix is that connection between the vagina and the uterus, that is the womb. That space from the vagina to the womb is known as the cervix. So, what causes cervical cancer? Cervical cancer is caused by a virus which is known as the human papilloma virus, for short, HPV. Now, there are about 100 types of this human papilloma virus, but only about 2 causes cervical cancer. The others could cause cancer of the penis, vulvar cancer, vaginal cancer, anal cancer, and others. Which means men can spread this virus because it is this same human papilloma virus that causes the cancer of the penis in men. And this virus is spread through having unprotected sex with an infected person. What are the symptoms of cervical cancer? If you're a woman and you're having vaginal bleeding during sex or after sex, please visit the doctor. If you're having pain while having sex, please take it serious and go see a doctor. If you're having unusual and abnormal vaginal discharge, please go and see a doctor. If you're having pelvic pain, lower back pain, and heavier periods than you used to have, please go and see a doctor, because these symptoms are suggestive of cervical cancer. In the UK, the NHS offers free cervical screening for every woman because as long as you're a woman and you have a cervix, you are prone to having cervical cancer. For women between the ages of 25 to 49, their free screening is done for them every 3 years. And for women between the ages of 50 and 64, free cervical screening is done for them every 5 years, just to make sure that if there are any abnormal cells, they are detected early and taken care of. But in Africa, the reverse is the case. There are no places to carry out this screening, and if you eventually find one, you will pay through your nose to get it done. That is why most women end up having cervical cancer, because they have these symptoms we've just mentioned. They have pain while having sex, abnormal bleeding, but they think is the result of the maybe harsh sex, rough sex they had that caused it. Not knowing these are symptoms of cervical cancer, they end up living with it, and they end up at the end with end stage cancer. At this point, nothing can be done because multiple organs have failed. The kidneys have been affected. Now they have kidney failure, and all they are doing is dying. So, because this virus was not detected early, because there was nothing like cervical screening which would detect the presence of the virus. Also, in other developed countries, the same thing. Cervical screening is done for women. It's done for them regularly, which helps to detect the virus early. Early detection remains the ultimate. So, there are treatments for this in case for women who have gotten this cancer. Radiotherapy can be done, which is the first one. In radiotherapy, radiation is used to destroy the cancerous cells of the cervix. We also have chemotherapy, which is the use of drugs, chemicals to destroy the cancerous cells. And sometimes radiotherapy and chemotherapy are used together in combination to treat this woman. And if all measures fail, the next option is to do what we call a radical hysterectomy, which means total removal of the womb, that's the uterus, the cervix, total removal of this womb and cervix, just to make sure that this cancer does not spread to the surrounding organs. Because if it spreads, it is now at the end stage and nothing can be done anymore. This woman would lose her life. She will lose her life. So, if everything has been done and nothing can remedy the situation, hysterectomy is the next option just to save this woman's life. At least her life will be prolonged. Even if she will lose her womb, her life will be prolonged. So there are also vaccines that can be taken to reduce the risk of contacting this virus. We have Cervarix, we have Gardasil. Now, if you're a woman, please go get your screening done. The screening is simple. It's called pap smear test. An instrument is just put through your vagina to widen the view of the cervix. So the nurse, whoever doing it, will be able to see your cervix very well. And then a small brush, very tiny brush, is put through your vagina, and to scrape some little cells, just little, which is looked under a microscope to see if there are any abnormal cells growing in your cervix. That is all. And you'll be safe for the rest of your life. So please go get your screening done. Go get vaccine. Vaccine is available for every woman from the age of 9. You can get your cervical vaccine. The Cervarix, Gardasil are available. Please go get them. So if you have any questions, please ask me in the comment section. If you have any comments to drop, contribution, whatever, please put it down in the comment section. I'll be reading. And if you've not subscribed to this channel, please click on the subscribe button and like the video, so that when next I post any educative video like this again, you will see it. I promise to be posting interesting videos here, very educational. Subscribe so you can get notification. See you guys in my next video.